Hello, everyone. Let's see. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today's the last day in January, January 31st. It's our Monday 2:30 Facebook Live update on the impact of the COVID-19 pandemic on Mobile County. Yesterday, 282 cases of COVID-19 were reported to us. If you've been keeping a watch on our weekly and daily reports, you can see that we continue to see a reduction in the number of cases reported to us. We know that there has been a stark decline since the holidays ended. There is a limit on community testing availability. Demand for testing has gone down, and then we are seeing some of those at-home test kits begin to get delivered throughout the county. So we'll continue to expect that the availability of at-home test kits and sort of this shift in focus from testing to, community testing, point-of-care test to more at-home testing. And it will continue to sort of, make it harder for us to sort of tell what's going on in the community just based on the number of cases. But we're glad that the number of cases is going in the right direction, and that is down. So a cumulative number of 107,487 tests reported to us so far. 1,467 people have died with COVID, and yesterday there were 287 people in the hospital. That brings the total of number hospitalized to 10,557. If you take a look at our weekly expanded report, again, the number of cases has gone down dramatically. January is going to be by far the month with the highest number of cases on record for our COVID-19 pandemic. But again, thankfully, the Omicron variant, which is greater than 99% of what we're seeing out there, is less severe. So it's not had the impact on our community. It's not had the same impact on our community as we saw with Delta and Alpha and the parent strain. The number of admissions is, dropping slightly every day. So we're still seeing somewhat of a stabilization of hospitalizations, hovering sort of around 300. Last couple of days, it's been less than 300 in the hospital, so we are grateful for that. The number of deaths reported to us has gone up for the month of January. So far, we're reporting on 63 deaths that occurred in the month of January. That is the highest number since September. So we will continue to see hospitalizations and deaths. We're just pleased that there aren't as many as we saw in earlier waves related to the number of cases that we had, and hospitalizations seem to be less severe. The percent positive that we keep a look at, it's down to around 34%, I think, if I'm reading that correctly. Yeah. So we're still seeing a fairly high volume of testing out there, but again, the percent positive, while still very high, 1 in 3 people testing are positive for COVID, it is still lower than the high of over 50% that we've seen in the last couple of weeks from time to time when we saw our peak. So I asked Mark to put this graphic up. We show this every once in a while. Sort of shows the number of COVID cases, hospitalizations, and deaths, the Omicron wave more recently compared to the Delta wave, which was back in late July, August, and September. And you see that sort of weird Monday through Friday effect, right, where weekends we have less testing going on. But so that's the reason you see those sawtooth patterns for the number of cases. Then the number of hospitalization lags, and then the number of deaths lags behind hospitalization. So that's what we saw very clearly in the Delta wave. But if you look at how that compares with the Omicron wave, we had just an incredibly large number of cases reported compared to Delta. So probably end up being at least 2 or 3 times the number of cases reported. But the hospitalizations and deaths are lagging behind, but you can see that the number of hospitalizations and deaths is still lower than what we saw with the Delta strain in August and September. So again, partly due to the fact that the Omicron variant is less severe, then also helping us are high vaccination rates at long-term care facilities and high vaccination rates in the older populations that are more vulnerable to complications and deaths. So again, the impact that the vaccine has had in keeping us from seeing those record numbers of hospitalizations and deaths, that combined with the fact, and maybe more so the fact, that Omicron is a less severe variant than Delta, Alpha, or the parent strain. So let me move on then. Glad to see everything moving in the right direction. It will take us some time, as we've discussed, before we get back down to less than 5% positive or only 10 people in the hospital with COVID. That's what we're trying to get back to. We enjoyed that in November and early December. It's going to take some time before we get back down to those levels, but keep getting vaccinated, keep wearing your mask if you aren't vaccinated. Everybody wear their mask, but particularly if you're not vaccinated, keep your distance, wear a mask. Everybody stay at home if they're sick so that we can stop transmission of the Omicron variant in our community. All of the Omicron sequences that we're seeing right now in Mobile County are Omicron, not what people are calling the stealth Omicron. So that one has been detected in 2 or 3 states, but it is still a very low level, and it's not been detected yet in Mobile. No reason to think that this variant of Omicron variant is going to be much different than what we're seeing now. So don't worry too much about that yet, or unless we learn more or different information. So just a couple of updates, and then I'll tell you, give you some information about where we are going to be in the community this week and next. Let me get around to those pieces of information. So just a couple of announcements. Everyone's been hearing about the testing, the national program to get at-home test kits in the homes of every American. So please, if you've not already, go to covidtest.org and sign up to receive 2 at-home test kits. Each kit contains 2 tests. So that will be for you to use if you have an exposure in your house, or if you're exposed at work or something and you maybe want to test following exposure to make sure that if you are infected with COVID that you stay home. Also, there is a federal mask effort underway, and these are, I believe, they're going to be approved N95 masks or KN95 masks that are going to be distributed through the Strategic National Stockpile through retail pharmacies and federally qualified healthcare centers. So I've given to Mark a couple links that he can post where you can go to find the pharmacies that are participating in COVID-19 vaccination and mask distribution, so that when they have the masks, this is where you will go to try to pick up some free masks for yourself and your family. And then also federally qualified health centers or community health centers will be engaged in distributing masks as well, and also probably COVID test kits. So more to come on that, but there's also a link that you can go. There were probably 15 different businesses that are going to be retail pharmacies that have COVID vaccine and are going to be distributing masks. So please find the one closest to you so that when they have stocks on those things that you'll know where to go. And then for the healthcare center, right now there's only one listed in Mobile that's currently participating in the federal mask program. But stay tuned for that, because I'm sure that more community health centers will get involved with that. Let's see. We had some information provided to us, or sort of a reminder. The Alabama Department of Health commented on a morbidity and mortality weekly report that was published by the Centers for Disease Control. Basically, the report states that during periods of Delta and Omicron variant, as those emerged, COVID-19 vaccinations protected against both variants. So we've been looking for data, science, evidence to show that vaccine works well against the Omicron. This was a study in data from 25 states. Alabama was included. And what they found was that unvaccinated adults had a 5 times higher risk of infection compared with adults who were fully vaccinated and boosted. So again, just more real world data to show that vaccines work to reduce infections, severe complications, hospitalizations, and deaths, as much as 5 times better than people who are unvaccinated. And again, this is against Delta and Omicron. So if you've not begun your vaccination series, please do so. to try to protect yourself and your family. Let's see. If you have questions, I know a lot of the information that we provide and that CDC provides, it seems like it's changing all the time, and you don't know what to believe or, what page to find things on the Alabama Department of Public Health website or the CDC website. So we have help for you. Please send an email to COVID-19@mchd.org. Again, COVID-19@mchd.org. Do not suffer in silence. If you have a question, please email us so that we can help you and assist you to get credible, reliable, and the most up-to-date information that we can. CDC also commented this afternoon on a national call that I participated in that there has been a little bit of movement on the front for getting a Pfizer vaccine for children between the ages of 6 months and 5 years of age. So this would be a vaccine schedule for children 6 months or greater, would be 3 doses of Pfizer. There has been some discussion about it. You might have heard Dr. Fauci commenting on it that he hopes it's going to be pretty soon. I think the manufacturer has said sometime in the first half of 2022. So for those of you who are looking to get vaccine for your child that's between the age of 6 months and 5 years old, please keep hanging on and listening in, and we'll get that information to you and start offering those vaccines as soon as we can. So we have a couple of questions here. So someone asking about people testing negative for flu and COVID but are getting ill anyway. There are about 12, 15 maybe respiratory viruses that circulate during seasonal influenza. So rhinovirus, enterovirus, metapneumovirus, 4 or so other coronaviruses that circulate, influenza, as you've noted, and COVID-19. So a lot of these have RSV, a lot of them have very similar symptoms. So it's not always easy to tell what respiratory virus may be making people ill. We certainly do look into clusters of illness, things that happen sort of that have maybe are resistant to some antivirals, or if there's a pattern that doesn't look normal. But a lot of what's going out there may be just sort of, the normal respiratory viruses that we see circulating every winter. Remember, we didn't have much of a respiratory virus season last year. We didn't have really a seasonal flu last year because schools were doing virtual learning. Some businesses were closed. Everybody was wearing their mask and staying at home. So we're seeing sort of a jump up of things this year because many people have just gone back to sort of their normal patterns. Let's see. Someone don't understand that comment or question, so I'm going to pass on that one for today. Okay, some good news just to let you know about what's going on in the community and at the health department. We're always trying to do what we need to do to adapt to the outbreak and the changes and availability of testing and vaccine and just, be as nimble as we can to serve our community in the best way that we possibly can. Toward that end, we used some of the Centers for Disease Control and Prevention epidemiology and laboratory capacity grant money that was passed through to us from ADPH, and we have purchased a mobile medical trailer. We call it the Public Health Response Unit number 1 because there is a second one that should be arriving sometime this year. So again, we're trying just to enhance accessibility in the community. This one is going to be placed at our SIMS clinic. It is mobile, so we could move it if we have a need to, or decide that we want to try a different location. But for the foreseeable future, we're going to be providing vaccine out of this mobile medical unit at our SIMS Health Center at 3810 Wolf Road East. Now, don't go into the brick and mortar building seeking vaccine on Fridays. On Fridays, we're going to be in the mobile trailer. So it's sitting where it's clearly visible at the Sims Clinic. I've not seen it, but I'm told that you can't miss it. So we're going to be there starting this Friday from 9 to 3 p.m., providing all, any of the COVID-19 vaccines for anyone who is eligible. Again, that's at our Sims Clinic. We've been really wanting to get a stronger, more consistent presence in West Mobile, and since we have a clinic there, we are happy to put the mobile trailer there so that we can do vaccines just out of that trailer and not even have to have people go inside. So we're excited about that. And then also, since we are no longer able to offer testing at our Festival Center location, we're still giving vaccines there. So at the Festival Center location at Suite 101A at the corner of Airport and Mont-Lamar, we are still there Monday through Friday, 9 to 6, and Saturday, 10 to 1. And there is no waiting, no line, no fee. There is some paperwork that you have to fill out, but please come there to get tested. There's plenty of parking. It's a nice open building. So, it's pretty safe place, and we're very happy to still be providing vaccine out of that location. So we have the Festival Center, we have the Sims trailer location now. We also are still running our homebound mission. So if you know someone or someone in your family or close friend who is homebound for any reason, whether it's health reason, mobility reasons, please go to our website at mchdcares.com and click on the Request at Home Vaccination tab, and they will be able to help you you can sign up yourself for in-home vaccination. Our team is doing those on Wednesdays and Fridays. We've got plenty of capacity right now, so please let us know. So Festival Center, Sims parking lot in the trailer, homebound residents, and then these are the community vaccine events that we have over the next 2 weeks. So on February 2nd, that's just this Wednesday, we'll be at a church in Mount Vernon. On Saturday the 5th, we'll be at McCants-Chavers Park in Mobile. On the 9th, we will be at St. John's Episcopal Church in Mobile. On Thursday the 17th, we'll be at VIA Health, Fitness, and Enrichment Center. On the 19th, Saturday the 19th, be at Friendship Missionary Baptist to give vaccine. And then on Wednesday, February 23rd, another church event at Mount Vernon. So please, go to mchdcares.com on a regular basis because we are adding new events all the time. And if you have an idea for an event, remember, we need a pretty good commitment from you about, a pledge, people's pledge that they're going to get vaccinated, because it's not an easy undertaking to get the team and all the vaccines and all the stuff to where we need to go. So we really like to partner with people who are good advocates for vaccine and can help us reduce vaccine hesitancy by, answering questions and bringing people in who really want to get vaccinated. So again, most important thing is go to mchdcares.com and take a look at the vaccine events that we have going on there. We're really very proud of the vaccine team and the testing team. When we ran out of testing materials and had to sort of abruptly close our community testing clinic or shut down community testing at the Festival Center, our team has done a really great job of trying to get back on the phone and back in people's inboxes to get these community vaccine events scheduled so that we can offer vaccine around our county, in addition to the fixed locations that we have, which is, remember, at the Festival Center, Friday at our Sims Clinic in the trailer, and then for homebound if you give us a call. Just want to remind you still, if you have symptoms of COVID or if you need to get a COVID test, you can do that through the health department by making an appointment. So you make an appointment with a provider, same way that you would do if you were going to your own doctor, but you'll need to call 690-8889 to get an appointment for COVID testing. So Mark has given me that's all, folks. Sign. So I doubt we'll be speaking with you again this week, but we probably will do this on Mondays for another couple of weeks, as there is new information coming out about at-home tests and being able to get masks here, there, and everywhere. So stay safe, everyone. If you have not gotten your vaccine, please get vaccinated. When you're out in the community, still wear a mask. physically distance. Stay at home if you're sick. That is a big message. If you are sick, stay at home to prevent giving your illness to others. So have a great, safe week, and we'll talk to you next time.